Social Action for Health is a community development agency. This DVD talks about the work that we do here in Social Action, which involves grassroots people who are trained, and they work with the local communities, bringing people together to help them to take control of their own lives.
I came to Social Action for Health as a voluntary worker, and after done my Soul for Parents course, I did some sessional work, and now I'm working a self-management project, and the self-management is a 6 weeks course for someone who has got chronic condition. One lady, she done the course as a carer, and after finished she really enjoyed the course and she find it very helpful for her to look after her family.
My work as a health guide is to do outreach in my community in 10 hamlets. The community action group that was set up is for my health guide session, and these are the people who are very keen to make a change in the community. I mean, there's so many stories to tell. I'm going to tell one particular issue is with people with language difficulty, and this community is from Chinese, Somali, and Bangladesh as well. What used to happen is whenever they used to have a condition, if the surgery was unable to give appointment or the surgery was closed, they used to go to A&E. So we told them about different type of care, so self-care, urgent care, non-urgent care, and emergency care.
The experience that I've got from working with Social Action has given me a lot of confidence and also training to be able to go on the wards and engage with people. At that time, my confidence grew from the training that I had done there, and I felt that, you know, if people was to listen to some of the sessions that we ran, they would, and not initially, but in time, would remember some of the stuff that we taught them, and this would help them to develop themselves in the future.
I became chair of the People's Network because I have experience of facilitating groups through my work as a mental health guide. The mental health guides being lay people who are trained in the community to better represent their communities, feedback the issues and concerns of the people that they represent. I think it's giving them a space to be able to talk about their own experiences, because in the mental health system it's not encouraged to own your own experiences, and it's kind of frowned upon because it's a very much a medicalised model in that people are medicated rather than integrated back into community through socialising, eating together, talking about their experiences and learning from their experiences.
The DVD also focuses on one of our very successful groups, the Patient Network, which is a group that's come together having done a self-management course looking at people who have had chronic health conditions, and they have looked at action planning and how they can take control of their lives.
Self-management course started 6 years ago with as part of the Expert Patients program. It was led by lay people who were also having a chronic condition, so that we can actually understand where we are coming from. When we first met 2.5 years ago, tell us how big you were.
21 stone and 10 I was, and now I'm 13 stone.
Oh, well done. Yeah.
Oh, my doctor, she's recommended me to come to you, and it really motivated me. It's the most important thing is motivation, right? And the other most important thing is, and I keep telling you, the word can't does not exist. You can't do anything if you want to.
I've attended every single session since the course, and I've found a lot of support. I mean, people that are likewise, we all suffer with long-term illnesses, and we get a chance to discuss our problems and how we can overcome them. And Ida's been our inspiration. The older I am, I'm improving. I can walk now where I couldn't walk when I attended the course.
Once I started coming here, I come every month. I look forward to go. You share your problems. We talk about it. And it helps again.
Because this group belongs to you, like I said. I'm just here to facilitate. And, so group is you.
Yeah, I originally came with him because he'd had a serious operation. I
Yeah.
came with him as his carer, and I've been coming ever since. And we enjoy coming in over once a month,
Yeah.
and it gets us out,
Mm.
meeting other people.
Yeah.
Most of the people here are retired, and some of them don't actually have anywhere to go except hospital appointments. So, and I think also we use this group as almost like a air and share.
So I've been coming here and I feel, like you get a bit more stronger and you learn new things. Obviously there's different people and then, like things you don't know and you hear new things and you get new supports.
The GPs always recommend antidepressants, for patients. But one thing they don't realize is that talking therapy is like coming down here. Most people don't want to let go. You see, but the talking therapy, you share your views with other people. You see, so that motivates a lot of energy. You see, it's not just taking tablets all the time. I don't say give up the medications your GP is giving you, but sometimes it's good for the patients to tell the GP that, look, I prefer the talking therapy.
After the operation, I just couldn't be bothered. My self-esteem went zoom. I sat on the chair all day without moving until I got a letter from here. That was 2 years ago. And that really motivated me to, get up and go. So since then I've been getting up and going.
Yes.